So I am Dr. Rodriguez from Mexico Bariatric Center. I'm part of the surgical team. Today we're gonna do a webinar. If you have questions about weight loss surgery or questions about coming to Tijuana, please feel free to ask anything, okay? We're gonna be here to answer everything about weight loss surgery. So they're asking about why gives better long-term results bypass versus sleeve. Well, in the gastric bypass, we do surgery in the stomach, but also we do surgery in the small bowel. And in sleep, we only do surgery in the stomach. So the gastric bypass is a bigger surgery because we do the stomach smaller, and also we reconnect the small bowel to have more weight loss surgery. So that's why bypass has better long-term results versus sleep. Okay, they're asking about the post-op diet. After weight loss surgery, your stomach is healing. So we need to do a special surgery to let your stomach heal. So we're gonna start with liquid diet. About 5 to 7 days, we can progress to smooth diet, chicken broth. We can do protein shakes. Then we can increase the consistency of the food. We can go to like purees, and then after 1 month after surgery, you're gonna start with normal food. So we need to do increase the consistency of the food every week or every 2 weeks to let the stomach heal. Okay. So, Jessica Jackson, I'm scheduled for ESG with you on June 28th. Oh, we're gonna be waiting for you, Jessica. ESG is the endoscopic sleep. We have two options to do is gastric sleep. Traditional is laparoscopic sleep, and we need to make your stomach smaller. And the new procedure is endoscopic sleep. We need to make your stomach smaller, but we're not gonna cut your abdominal wall, and we're not gonna cut your stomach. We're gonna introduce endoscope through your mouth and do some stitches and make your stomach smaller. So it is a new procedure, and we're gonna waiting for you, Jessica. So when you do the gastric sleeve, you are using staples to close it. Do you also stitch sew it to close to? Yes. We always reinforce all the staple line of the gastric sleeve and all the weight loss surgeries to have to down to don't have a risk of bleeding and to decrease the risk of a leak. So yes, we always reinforce all the surgeries. It's gonna be safety if we do that. Okay. We always use a staple, titanium staples to do the surgery, and we do a second layer of suture. They're asking if I had gallbladder surgery previously, can the doctor go through my previous incisions or will new ones be made? We need to do a new ones because the gallbladder is in a different position of the stomach. So yes, sometimes we can use one incisions, but we need to do new incisions. Yes. How did surgeons keep up with the latest information of bariatric surgery? Okay, we always need to update everything about weight loss surgery. So we need to go to the medical meetings here in Mexico, in United States, and around the world. We need to be certified in the Mexican National College of Surgeons. We also need to be certified in the American College of Surgeons and also in the international. Federation of Weight Loss Surgery. So we always are updating all about the medical and weight loss surgery treatments. Colleen, what's the percentage of long-term weight loss with endoscopic versus laparoscopic sleep? Well, yeah, it is totally different. Uh, Laparoscopic sleep has better weight loss results because it is a more aggressive treatment. Also, the risks are higher. But if you want numbers, laparoscopic sleep can give you to 60 to 80% of success, and endoscopic sleep we can go something around 20 to 40% of success. So yes, it is very different, and we have better results with laparoscopic sleep. Would the vitamins be something that we would want to start before surgery? Yes, you can start before surgery. After surgery, you gotta stop taking your vitamins about 1 or 2 weeks to let your stomach heal. But yes, you can start before surgery. I recommend to do that. Also with the protein shakes. Does the hospital have the right conditions? Is there a support group for post-aspiration, psychologist, nutritionist? Can my husband, who could accompany me? Okay, yes. Well, I need to tell you that we're gonna have a new hospital probably in the next month. But yes, our hospital has the right conditions, and the new one is gonna be wonderful. We have a support group. You can you're gonna be in the support group after surgery, and we're gonna give you all the information about nutritionists and psychologists. Yes. And can my husband be your companion? Yes, he could be. Can be your companion. When I will see my doctors, you're gonna see your doctors before surgery and after surgery. Kimberly is asking, can you explain more about the process of duodenal surgery? What type of body will this be the best choice for? Okay, duodenal surgery is this duodenal switch or SATIS, the one that's the most is duodenal switch, is the best options by when patients have high BMI, probably BMI higher than 50. Also, when we have a really metabolic patients, diabetes, high blood pressure, PCOS, sleep apnea. So those patients need a better or a more bigger tool to weight loss, so Duodenal Switch is gonna be the best option. So the main difference is we need to preserve the pyloric valve. When when we preserve the pyloric valve, we can do a more absorptive surgery without having complications. So Duodenal Switch is designed for high BMI and really metabolic patients. Do I need to stop birth control hormone replacement therapies? Yes, we recommend to stop all the hormonal treatment because they can increase the risk of clots in your legs and also in your lungs, and that is really dangerous. So yes, we recommend to stop them. Hello, Christine. How are you? You did my surgery almost a year ago. Oh, please send the photos. I'm really happy you're doing better. Nice. I'm wondering about malabsorption issues following the DS, is asking Christine. Well, the DS is the most powerful tool for weight loss surgery, and after duodenal switch, patients must be really, really disciplined with supplementation, protein, and vitamins. And yes, sometimes when patients have diarrhea, you can call me back to give you some information about how to control diarrhea. And but yeah, supplementation is really, really, really important in duodenal switch. It's the most important part. Yvette is asking, my son is 620 pounds. You approve him for sleep. Is that the best choice? Well, probably the best option for your son is gonna be a duodenal switch, Yvette, because we can have better long-term weight loss results. Yes. The duodenal switch is a combination of gastric sleeve and the malabsorption part. So the duodenal switch is going to be the best option for your son, Yvette. If your BMI is 43, I recommend regular gastric sleeve, okay? Single incision gastric sleeve, sometimes we can do it when BMI is higher than 40, but probably 40 or less than 40 is going to be better option for a single incision. Daniela Amabiska is asking, does the DS help to thyroid patients? Yes, the duodenal switch can help you with all the metabolic disease, and the thyroid is a gland that promotes metabolic issues. So yes, duodenal switch can help you with thyroid patients for sure. Angelica Flores is asking, when crossing the border, do they let us bring our medication? You guys provide us? Yes. We're gonna give you a prescription, and you will have no problem to bring your medication back to home. When you're traveling home after surgery on a long flight, would you suggest a belly band? It is not necessary, but if you want, you can use it, but it's not necessary. Hello, Kimberly. How are you? I will be waiting for you on May 9th. Kimberly is asking, why is a revisional from RNY gastric bypass to duodenal complex than any other revisional surgery? Because we need to reconnect the stomach. So that is the most complex part on bariatric surgery. We need to reconnect the gastric pouch to the gastric remnant. So that's why it's really complex. Complex. Okay, Kimberly, we're gonna wait. We're gonna be waiting for you on June 4th. Don't stop the pressure medication. Please continue with medication. Okay, Kimberly? Don't change it. Karen is asking, I'm 3 weeks post-op and I can't tolerate any food yet. I'm constantly gagging and feel dizzy when when I stand up. Any suggestion? Okay, it's normal to have to feel this because at the beginning, the first month is really tight. We need more time to be more loose. But if you don't if you feel dizziness, probably is the blood pressure. So you need to go back to the diet, to the step of the diet. So we recommend to hydration and go back to the liquid diet. Okay. So a lot of people I have spoke to complain of hair loss and tiny hair. Is there any way to prevent those? It's normal to lose weight. Probably you're gonna start losing hair after 6 months after surgery. It's totally normal. But what you can do is protein supplementation and also vitamin B supplementation. That's the only way, and follow the nutritional instructions after surgery. But yes, it's normal to have hair loss after surgery. Jessica, how many sutures are you using during ESG? Normally we use five, sometimes six sutures. It will depend on the size of your stomach. Do we stop thyroid medication before surgery? No, don't stop thyroid medication, Daniela. No. Probably you're gonna stop medication after a couple of months after surgery, but don't stop before surgery. I'm excited for my sleep surgery. Oh, we're gonna be waiting for you, Daniela. I hear of people needing a revision surgery. How common is that, and what is the main reason people need sleep revision? Well, the sleep can get stretched if you don't follow instructions. If you keep doing big meals, you're gonna stretch your gastric sleeve. So that's why the reason of regain. So when patients have regain because gastric sleeve stretchness, we need to do a revisional surgery to have more restriction. But if you follow the diet, you're not gonna need the sleep revision. Brittany, what medication do they typically use during after surgery for the anesthesia and pain? Okay, we try not to use opioid in weight loss surgery, but sometimes we use it, and we use traditional painkillers. So weight loss surgery is not a painful surgery, so we can control pain with traditional painkillers, but sometimes we use opioids to control pain. Angela, uh, I am too unclear which meds to stop before surgery. Will the nutrition help me with that when we meet? We're gonna give you all the information about medications, but please send your medication list to answer that question about what medications stop taking. Normally, you need to stop taking all the blood thinners. We need to do is really important about when patient is using blood thinners, aspirin, blood thinners to prevent bleeding. So please send all the list of medication to give you an answer. Sherry. We did surgery on March 14. I'm glad you're doing well, Sherry. So, Lily, I take CBD for anxiety, usually oils, coconut oil base. Yes, you can continue with CBD oil. Don't change it. So when patient use smoke CBD, we don't recommend smoking, but if you use it on oil, it's gonna be okay. No problem. Jessica Jackson is asking about the fundal ablation with ESG. Yes, when we do ESG, the fundus that is the part, it is a part of the stomach. Sometimes it's really hard to do sutures there. So there are many options to how to control the fundus. Uh, Sometimes we can do sutures there, but right now we don't do fundal ablations with DSG, but it is an option. Probably in one more year we can do fundal ablations with DSG. But at this moment, we try to do stitches in the fundus. Sometimes we cannot do stitches there, but yes, it is an option. You're welcome, Daniela. Hello, Jennifer. We did a mini in September 11. Congratulations. Oh, 87 pounds. Congratulations, Jennifer. Rachel, I'm having a status in July, a revision from vertical sleep. I wonder what happens to the other part of the small bowel that isn't reconnect. So there's no problem with the other part of the small bowel. It's gonna be there. It's not gonna absorb nutrients, but it's gonna give the pancreatic and the biliary enzymes that it's gonna mix in the reconnection. So it's gonna it's gonna be there, and there's no problem to be there. So don't worry about that. Hello, doctor. Can you talk about the hobbies you have outside of surgery? Yes, of course. Well, uh, I like a lot. I like to do music. So I believe I'm an artist guy. I like to play guitar, and also I like to play the piano with my kids. Also, I like to do judo. That is a martial arts. So I spend a lot of time doing exercise during judo. So that's what I like to do. Also, I like horses. I have horses, so I like to be with the horses. So there are my hobbies. Those are my hobbies. Thank you. One question is: will this the sleeve we resize? Yes, we need to remove all the stretches part of the previous gastric sleeve to have a restriction again. So yes, Rachel, if I see stretches part areas of the sleeve, we need to uh, reduce the sleep. Yes. So, Charisse, I had seals by you on March 22. It is normal to feel. Yes, it is normal because we put a stitch to close the belly button incisions. So it is a big incision there to perform surgery because in single incisions we do all the surgery through the belly. So yes, it's quite normal to feel tightness in the belly button. So Wendy is asking, I'm staying at hospital for 4 days. I am 62, and that is why. So normally, with when we do gastric sleeve, they spend 3 nights, sometimes 2 nights, and when we do gastric bypass or duodenal switch, or if it is a revisional surgery, we like to they stay 4 days in the hospital, just to be just for safety. Colleen, do most patients require skin removal surgery? Yes, yes. After weight loss surgery, a lot of patients need skin removal, and the best way to do it is with plastic surgery. Yes. Sani, it is okay to go from bypass to SATIS. Well, it is a really complex surgery. The most important part is the anatomic findings during surgery because I need to reconnect the stomach. So if I have a good stomach to reconnect, it is a good option. But sometimes, probably when the anatomy is not okay for do a reconnection, sometimes we need to only do a tune-up of the bypass. But it is a really complex surgery, and the result will depend on findings. So Andrew, how long does the pre-op test take? So about the laboratory test, it's um it's only 10 minutes. We need to do lab test 10 minutes, and we need to do AKG probably 20 minutes, so in total 30 minutes. Also, you need to sign all the medical uh, agreements, so probably you need to spend probably 30 to 45 minutes in the pre-op everything to when you arrive to the hospital. What is the expected recovery time for a visional from sleep to CDS? Probably the recovery time is going to be the same because we're going to do it through laparoscopic technique. It's going to be the same incisions. So recovery time, it could be from 10 days to 14 days. You're welcome, Rachel. Thank you. Okay, it is time to end the webinar. I'm really happy to be with you guys. I'm waiting for you in Tijuana. And if you have more questions, we can do a webinar again, okay? Thank you so much. Bye-bye.